I mean, it's relentless, never-ending, ongoing. That stigma that exists is actually driving people to use alone and die because of it.
On Tuesday, 2 days ahead of an official coroner's announcement, drug advocacy groups in Vancouver have released the number of people that died from illicit drug poisoning last year. The death toll has increased for a 10th straight year. Advocates say the numbers come from embargoed documents they received, and they're releasing the information to get ahead of the government.
2,224 folks who have passed away last year, which is 500 more than 2020's numbers.
And how are you feeling now? You know, this is a record-breaking figure, surely.
Well, I mean, I responded to an overdose last night at about 9 o'clock, so I'm feeling very despondent because it just seems like the situation is getting worse and worse, and that, you know, nobody is coming to help us. Nobody is coming to talk to us. We've been abandoned and left alone to struggle and fight for our own survival ourselves, you know. And as a drug user, I think that's an abhorrent response to this ongoing crisis, which is about to enter its 6th year.
In an interview with a local paper, BC's coroner Lisa Lapointe said the province's other pandemic now kills more than 6 people a day because its victims are considered less worthy. After getting sober, Guy Felicella has spent his time fighting to reduce the stigma attached to harm reduction and educate people on drug policy.
Yeah, I mean, the majority of society believes that anybody who uses illicit substances has an addiction or a substance use disorder towards them, and so our laws and policies actually reflect that as well. So naturally, society would believe those, but it's far from the truth. You wouldn't figure that anyone walking into a liquor store has a substance use disorder, so you wouldn't assume then that everybody who uses illicit substances would have the same issue.
Last year, BC's Ministry of Mental Health and Addictions created a first-of-its-kind prescribed safe supply program. They have also asked the federal government to decriminalize simple drug possession. And when drug poisoning deaths hit their last record in October, the ministry put $132 million into treatment and recovery care. Despite these moves, the death toll is still going up.
Well, I think, you know, what happens is we rely on harm reduction to reduce the harms caused by those drug policies. And what we need to do is actually change the drug policies instead of relying on harm reduction.
We reached out to the BC Coroner's Service to confirm the reported number of deaths, but they did not respond before broadcast. In Vancouver, Kier Junos, City News.